Thank you for this opportunity to speak this afternoon. And what I'm going to do, I'm trying to make these links between research, policy, practice, and education. I started by thinking about some research that we've been doing here locally, nursing at the extremes, about UK intensive care settings. We were looking particularly at how nurses work under stress in caring in extreme conditions, both in critical care and intensive psychiatric care. Those questions, as we'll see in a moment, came from practice. We then, and I'm not going to try to attempt to define compassion and care, what I want to do is for us to think through these cases what we think care and compassion are. And I was intrigued and captivated by the YouTube video that we saw, the Johnson & Johnson, where caring was linked to inspiration and empowerment around innovation for improving healthcare. So as we look at these cases today, it's for us to make linkages about what we think are compassion and care. The case study from Malawi is based on the PhD of Gladys Msiska, who was gained her doctorate here and is now back in Malawi working on compassionate care, taking it forward in terms of education. And then also I'm on the advisory committee of a Wellcome funded project in Tanzania, which is looking particularly around empowerment and ethics in maternal and child health care in remote and extreme conditions. I was reading a first year review that I'm going to be involved in tomorrow, and one of the insights that the doctoral student had, and I think was a key reference that jumped out at me as being very, very relevant for today, was that the distinctiveness of the place in which care takes place is actually crucial to any analysis of globalized care. And I think that we can see that through our examples this afternoon, that care, there may be components that are shared, but there's also the distinctiveness in the different places in which care takes place. No, I've done this wrong. Yeah, this one. Yeah. Sorry. Yeah, I can do it in sometimes. The project that we did here in intensive care was, as I said, it came as a result of practice, results of conversations about stress and burnout in different intensive care settings, and an exploration of the nature of work of an intensive care nurse. We looked at a concept which I think is very, very important, which indeed both the Tanzanian team and also Gladys in her PhD was analysing a concept called emotional labour, which isn't just about maternity care. Also, it was an opportunity to engage with practitioners about research about emotional labour to see to what extent it was useful and applicable in practice. Really, just to give you that brief definition, and really what I think we have concluded that by the way you manage your feelings, this is the process by which you deliver and ensure compassionate care. I'm hoping that the examples I'm going to give you are going to be able to illustrate that to some extent. So this was here a group of critical care nurses here in Scotland who were talking about how they had to manage their feelings in very, very extreme situations. That in everyday life they may have felt that they wanted to cry in these situations, but within the professional context of care, compassionate care, they had to manage those emotions, A, to deliver competent care, but also to support other staff, patients and relatives. So one of the issues was we got people to think about the words that would describe their work, and then also what were their barriers and enablers. There's a few words. There are a few examples of what were seen as enablers and barriers. And I think, as you'll see, as we look at the issues in Malawi and Tanzania, these issues too come to the fore. So I think it's this idea that care and compassionate care is a global context, a concept, but with different contexts. So for us, some of our emerging themes were this need to put on a face, the importance of valuing each other, working as teams, being able to work in the right sort of environment, and the importance of ensuring emotional care and getting to the heart of the work. So the heart of the work, moving to the extremes, there, both in Tanzania and Malawi, Millennium Development Goals 4 and 5, critical, reducing child mortality and improving maternal health. And as we just heard from Neil, maternal mortality in Malawi is very high. Similarly in Tanzania, 67% of all maternal deaths globally in Tanzania take place in Tanzania. So it's high, and Malawi is probably similar. So interesting to look at the workforce. Who are the workforce who are delivering this care, and why are nurses and midwives so important? And I think we can see from that simple breakdown of statistics that there's a great difference between the UK, Malawi and Tanzania, but also that there are far more nurses proportionally at the front line than doctors or physicians. So incredibly important frontline workers delivering the compassionate care. Now, if you want to read more about Gladys, there's her a link to a blog that we have in nursing studies here in Edinburgh. We had a writer in residence. She interviewed Gladys, and Gladys was able to give some insights about working in Malawi and what she will take back. Also really, really important, Malawi, the warm heart of Africa. This is very important in terms of culturally feeling of warmth and engagement. But, as Gladys found, nursing in Malawi is an emotive subject. The aspiration is for the warm heart of Africa, but there are severe shortages of nurses, lack of essential supplies, and negative attitudes. Gladys did a qualitative study, a phenomenological study with senior student nurses. She interviewed them, finding out about their clinical learning. And through that, she gathered these accounts of what they were engaging with, both in terms of their learning, but also in terms of their delivery of care. Important to make the connection that the shortage in Malawi was very much linked to that brain and care drain. So it wasn't just the fact that nurses from Malawi were actually being attracted to Britain at that time in the early 2000s, when there was a big recruitment drive to recruit overseas nurses for the NHS. And as the majority of nurses are women, it's also connected to a care drain. They are the main carers, both domestically as well as professionally in their own countries. So it is a double drain. From the point of view of the student nurse, a senior student nurse, what they felt they were doing, their general experience when they were in the wards, was that they were covering shortage. They were part of the workforce. And indeed, that had been very much how it was in the UK, the apprenticeship nurses at the Frontline. But the student nurses in Malawi were finding that it was seriously interfering with their learning. The other problem was lack of essential supplies, and that very stressful situation of not having the necessary resources, but having the knowledge and skill, so maybe being able to deal with those difficult situations. Very difficult were the negative attitudes. And as one senior student said, I thought nurses are more or less like angels, so that image of the nurse as angel is a very strong icon. And for a student nurse, it disappointed them that they saw poor attitudes and mishandling of patients. It disturbed them. But then there was the other issue of shouting, and they found this very, very difficult. So in terms of the compassionate care, it seemed to be the flip side, but it's about not seeing it at face value, but getting behind. Now, interestingly, in Malawi, that's the national image of the nurse, but very, very important, treat nurses and midwives well, and in that way, you retain more nurses and midwives, and also training and education is really, really important, more of them, enough resource. And in the middle of this, the students saw the nurses who could still care. That whole issue, they leave their problems at the door. And so this issue about what nurses can do, they can change, the student nurses were thinking they can see, they can change the image of nursing themselves if they see how to care. So, why and how can nurses still care in these very, very difficult, extreme conditions? We haven't mentioned, apart from the fact of the high maternal and infant mortality, just what the students and the nurses are facing. People with HIV, AIDS, malaria, extreme conditions that the students are caring for, and as they said, not always with the resources. But the study in Tanzania, which was with internal and child maternal and child health units, was trying to look at reasons that allowed nurses and midwives to care. Tibadabad, she looked with her colleagues, looked at 2 hospitals and 2 health centres. Going back to the importance of research and policy, the team who are undertaking this research are a UK Tanzanian team working together. They found, we've already heard about caring is empowerment, they found empowerment was really, really important to allow nurses to do their jobs well. They had, like Gladys, undertaken a series of in-depth qualitative interviews and observations. In terms of getting the examples of 2 hospitals, which they call A and B, they found that they had pretty much the same problems, the same pressures, and patient complaints about rudeness. They actually did in-depth interviews with many of the women who were being cared for in the hospitals. But Hospital A seemed to be able to achieve higher quality of care. And it seemed to be that it was about a management system that had clear leadership, clear values, that promoted good professional behaviour, and really, really important, wouldn't tolerate bad professional behaviour. Of course, it's much more complicated than that, and for the sake of brevity, and I know I've just got a few minutes left, but these were some of the observations by nurse in charge and frontline midwives in Hospital A. Importance about relationships, value, and trying to manage with the limited resources. So a leadership that was able to deal with limited supplies. And the Hospital B, it was about the opposite, the lack of support. So we work in a very difficult environment, lack of incentives. So it was really about value. So I was grappling with a way to conclude, and I think that really care is often idealised as a feminised activity. Women's natural work actually requires skill and motivation. It's become part of a commoditised service economy in many countries, and people still won't pay for it. It's mostly undervalued. And as I said, in order for us to begin to try and understand the context and the distinctiveness of compassionate care in different contexts, we need to understand it in the particular location we find it.